The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Access Fort Wayne is a department of the Allen County Public Library. If you or anyone you know might be interested in making a television show, please call 260-421-1250.
Dr. Rudy Kachmann, thank you for watching our show on wellness. And today we have a very interesting subject. Most of us, one time or another, I think, probably suffer from it, depression, where we feel down. And I have a guest with me today, Grant Gerard, a psychiatric licensed social worker. He has a lot of experience with depression, and I thought we'd like to hear his part of the story. And with that, Grant, tell us a little bit about your group that you work with.
Okay. I work with Gerard, Koslow, and Tilker Sharp Associates. It's private practice, mental health therapy, and Phoenix Associates, where we do the same thing.
What type of depression are you mainly treating? Is it drugs or family problems or work problems? Give us some idea of what you're seeing.
Well, I see all over the map. About half of the people that I personally work with deal with substance abuse issues, and that's inextricably linked to depression as well as other emotional problems.
I mean, they're taking these drugs to make themselves feel better.
Often, yes.
They're traveling down here and they want to come up.
Absolutely.
Yeah. Some people use cigarettes, some use alcohol, and other people is from substance abuse. I found some even use sugar. It's a quick fix.
Yeah.
So this will be a very interesting subject. So let's kind of begin a little bit, and I'm basing a lot of this talk today on the Depression Cure by Stephen Ilardi here. I just hold it up for you. Very good book to read, and we'll discuss that in detail. Tell me, I'm going to tell you the symptoms, what I think signs depression is there, and then Gerard, Grant, I'd like to hear what you usually see. Okay, loss of energy, can't get out of bed, can't get to sleep, or can't wake up. Those are signs sometimes of depression. Loss of inability to concentrate is another one. Loss of joy, no happiness, always dwelling on negative things. For example, loss of confidence, loss of memory. Yeah, a loss of memory. Decreased sex drive. The will. Some get so deep they consider suicide. Let's face it. About 50% of the gun deaths are due to the availability of a gun and using it to commit suicide. It's mainly men. Women usually use pills. So many recover, but men use a gun, and are 90% successful. Yeah, so it's kind of scary. So tell me, the majority of patients you're seeing, how are they presenting to you?
Well, in addition to symptoms that you discussed, other clinical symptoms would include loss of appetite, for one, isolation is another one, often alienated from friends and family, reduced social activity.
No social group. In some, talking about the appetite, in some you start eating like anything because the sugar raises their dopamine serotonin level.
Absolutely.
I'm in heaven.
Absolutely.
Donut works for me.
So it can be either loss of appetite or overeating.
And a lot of the my experience, a lot of the overweight people who now develop diabetes, they were eating just to feel good.
Yeah.
So this is a judgment-free zone where you're saying what the reality is. Who of us, if I were to come home tonight after a busy day and all the things I've been doing, and if there's a donut laying there, believe me, even strong myself, I'd be eating it.
Oh, yeah.
So and let me tell you a little bit about nature. Nature designed in us a circuitry in our frontal lobe, in our hypothalamus, in centers that react very quickly to food, for example, or laughter. So to make us feel good or make us feel bad. We have in us we have a frontal lobe. Animals, for example, all they're worried about, frankly, is eating, reproduction, and staying alive. But we humans have developed a frontal lobe on top of that, and there's a circuitry there in nature. For example, nature designed it so we would seek sugar to stay alive. Okay, and that causes secretion of dopamine. That's a quick fix. You light up a cigarette, bango. You feel good for a few minutes, and then the nicotine level goes down. You need another one. Music, for example, can raise the dopamine level very quickly. And then that's the short-term fix. And then we have the long-term fix, the circuitry further back down the brainstem, is the serotonin. That's our contentment. So the balance of our psychiatry is dependent on the hypothalamus, the amygdala, the frontal lobe, the nucleus accumbens, 1 millimeter in size. That's where the dopamine is made. That's the quick fix. Laughter, walking in nature, love, for example, or cigarette or sugar, maybe even the internet, the dopamine response. But what we want is long-term contentment. We want the serotonin. And how genetic is depression? But where does it run in families? A lot or a certain percentage?
A good percentage. When they come in, usually when people come into my office that are suffering from clinical depression, which I would say differs from what we would generally call I'm feeling depressed today, or, I'm just not having a good day, frequent bad moods, I'm depressed, bereavement. Differing from that is the clinical, where oftentimes you do need adjunct pharmacotherapy in addition to psychotherapy, where general lifestyle changes are more effective when people are presenting with some symptoms but not enough to qualify as more moderate to severe.
Yeah. I was listening to Dr. Paul Wilson from Park Center, the psychiatric hospital, and I was presenting at a function with him, and it amazed me, although I've been thinking that, frankly, for years, what I was seeing in my practice of neurosurgery. He said 50% of people go see a doctor have mild, medium, or severe depression, and they're misdiagnosed 90% of the time. That's scary. Yeah.
Yeah.
And so I started reading about it. So I read this book years ago by Candace Pert, Molecules of Emotion. She discovered the science of why this occurred. She discovered the opiate receptor site. There are receptors in every cell in your body, and she's the one who developed the science of that. So when I was looking at patients, every cell in your body's got receptors on it, okay? So how you think is critical. And what she was saying, through hormones, neurotransmitters, neuropeptides, your thought process can secrete them, and they hit these receptors in your body, so you can be depressed in your body. Then she discovered your monocytes, your Army, Navy, Air Force, your immunity system secretes the same darn thing. So there's a mind-body connection. And what I found out in all those years, going back probably 30 years, I never met anybody who ever read that book. To me, that book's critical because a lot of patients presenting to us, I'd always say, what's going on in your life? Oh, well, you know, I lost my job. My husband left me 3 months ago, and I got 4 children. So then when they present as neck pain, as low back pain, and most, even still today, they head for the MRI and think the problem's on the MRI. The problem's not in the MRI, it's here. Not imaginary, it is real. Candace proved through the hormones, the neuropeptides, that this hits these receptors, and it is real. So when I look at people, I see the receptors, and I don't just look at the MRI. You know what I mean? The MRI is not the problem; it's their thought process. So what I thought I was treating many years of neurosurgery was really mind-body illnesses. They're real, but caused by the physiology of the neurotransmitters and hormones, neuropeptides of the thought process. And a lot of it started with mild, medium, or severe depression. Remember what Wilson said? That 90% are misdiagnosed because people are not looking, and it's not even taught in the med school. I can't believe this. I checked. I never met anybody, ever read her book, or then I wrote a book called The Mind-Body Connection, based on my experience. That's on Amazon. I've got about 15 books on there. And extending off this Candace Pert's book. What I was looking at a lot of the time was a mind-body illness. And we should have been looking at ways to treat that instead of operating on them. And still today, a lot of the people I see with pain problems, neck, low back pain, different things, if you don't interview them to see if they're depressed, for example, they're going to get an unnecessary operation. I saw a lot of that. It still occurs today. These MRIs are so good that they give you a process of aging, and we've made a disease out of it. An MRI report is a license to operate. Watch out. I see a lot of that, and I see a lot of that. So part of the problem is our bodies today were not designed to deal with the stresses of today. You know, we had the acute stress, that was Kachmann, 1910, where the tiger runs at you and your blood pressure goes up and your eyes dilate and you stop digesting the food and the blood sugar goes up, the fats go up, you start hyperventilating. That's the acute stress response. If the tiger doesn't kill you, it's over quickly. But now, Hans Seeley from Montreal published 1,000 papers, I think. You know, he was around 1960s. He was a German like me, and he tested animals. Matter of fact, he found if they stressed the animals enough, their blood pressure went up and their heart got big, and a lot of them died. So, matter of fact, the government no longer will approve research on animals for stress because he proved the point. The chronic stress, the long-term stress that many of us have. You know, I was a neurosurgeon all these years, so stressful every day. So you got to figure out ways to deal with it. I played tennis a lot at night, walked, music, exercise, different habits. And this book here, The Depression Cure, 6-step program to beat depression without drugs. I mean, the point, some people absolutely need drugs. They're curled up in little balls, and they can't think, they can't get up, they're sleeping all the time, they can't go to work. They can't rise themselves up. A lot of them take narcotics just to feel good for an hour or two. I understand it. Do you see people like that?
I do. I've been there myself.
Yeah, tell us about that a little bit. You told me before, and a lot of people that go into certain fields went through the problem and then they became teachers because they then know more about it. They felt it. You know what I mean?
Yeah.
Yeah. Mm-hmm. And I mean, you were telling me earlier, do you think you were born genetically with a little bit of a depression in the family?
Depression runs in the family. It does.
Uh-huh.
Mm-hmm. And I'm not sure. I think oftentimes around the early 20s for men, sometimes a bit younger for females, if you haven't endogenous depression, that's when it'll show
Endogenous
itself.
meaning genetic. Huh?
Genetic, yes.
Okay.
Whereas, the exogenous meaning the,
Yeah.
The environmental stressors that really can occur just about any time.
Yeah. But you
genetic is pretty predictable.
Yeah. Did you get into narcotics a little bit?
I did. I had an accident, and
a lot of times it starts where the doctor starts prescribing narcs.
Yeah, and I had them for months on end, and I liked them, and I got to be the age where I could drink legally.
Yeah.
And you mix those even with just one or two
Did you
pills.
start smoking too?
I was already smoking cigarettes.
You was already cigarettes.
Yep, that's that little dopamine.
The
People with
dopamine's
depression.
secreted. Remember we talked about that already?
Yeah.
It raises the mood, but the trouble is the nicotine level goes down and you get a light up again. And it's tough.
Well,
for many people, it's...
Doesn't nicotine increase your cortisol level too?
Yeah, exactly. Yeah.
So it's like it gives you that little bit of pleasure, but at the same time, it's almost making you more anxious and destructive to your body.
And withdrawal within minutes.
Yeah.
Right. Mm-hmm. How many minutes to the next cigarette?
Yeah. Well, it depends on how heavy you smoke.
Individual things. Yeah. But some people definitely need medication.
I definitely
You
would
know what I
agree
mean?
with that.
And some you do behavioral therapy, speaking
I would
therapy.
say we do that with all of them.
With all of them.
Preferably, that's the first line of treatment. And if you need to add a medication, you do.
How long do you normally treat a patient with behavioral therapy? For months at a time or years at a time?
Well, it varies greatly.
Yeah.
Part of it depends on how much, where a client is when they come in, how severe the depression.
You got it. Is it cognitive therapy? Is that what you call it?
Cognitive behavioral, because a lot of it's change in routine, change in behaviors, but also the thought process.
Yeah. Freud thought everything was related to your childhood experiences. And it took a long time before we kind of got over that, and then cognitive therapy came along, and that's what you do mainly.
Yeah.
You use pills on everybody or just some people?
No, actually, I don't prescribe myself. I refer to psychiatrists.
Yeah.
Most psychiatrists don't practice therapy. They strictly do medication now.
Yeah, I've heard that recently. They do all medication, which concerns me a little bit. But then again, you are screening them and you're sending only the worst patients. So probably the way it should be done. You know what I mean? Because remember, from Duke University, a 6-step program to reduce depression without medication, which is maybe 70% of the people.
I would
at least
if people are motivated, and a lot of people don't want medication, and if they don't want it, and are like, okay, I'm going to do what I can without it, then we're successful.
I'll be darned, in almost all of them.
It's possible, when they're
something?
motivated, yes.
Yeah, you're just, what I read here. And the things that this doctor from Duke recommends is omega-3 fats, which we can get from fish or a supplement or a pill. Do you also recommend that? Yeah. Originally in our body, living things did not have heart and lungs to circulate our chemicals around the body, okay? They had only cells, cellular animals, and they were largely made out of phospholipids. They're made out of fats and phosphates. That was our internet. The membrane of these cells are composed of fats, essential fats. Essential means you got to take it in. These omega-3 fats are necessary for the chemicals in your body to work, and that's given us through evolution. Originally, thousands of years ago, we were eating like the omega-3 fats, which are the main good ones. They're cousineoids, but you also need some omega-6 fats, and the ratio should be about 2 to 1, 3 to 1, something like that, or 1 to 1. But we Americans, because we eat so much bad food, we're running 15 to 1. And we're very low in omega-3 fats. They come actually from plants. And if the animal is not eating plants, like fish might eat algae. And the trouble is, a lot of fish now are raised in ponds. And you know what they feed them with? Corn. Yeah, genetically modified corn. So you're not getting omega-3 from fish, which they say you do. So some of us, I think, need to take a supplement. And other things, number 2 in this treatment program, a lifestyle change, okay? Therapeutic lifestyle is what we're talking about, is to participate in engaging activity. And I give myself as an example. I'm not exactly 39 years old. But I have a purpose. I'm teaching people to get well on a regular, full-time basis, radio, TV, I write books. I have a purpose, so I'm involved in engaging activity. You're involved in engaging activity, and that makes us smile. Okay?
Yeah.
You know, it works. Physical exercise is very important. It grows some brain cells, and it changes the chemistry of your body. So that's really one of the best things to avoid depression is exercise, isn't it?
Yeah, absolutely.
And thank you for agreeing to that. I mean, what do you do, really? Play tennis, play pickleball, take dance lessons, take tap dance lessons, write books.
Sure.
Whatever, all physical and mental exercise, okay? Next, this is an important one, sunlight exposure. Some of us, we know about these depressive syndromes depending on the time of year. In darkness, our brain is designed that we need a certain amount of light. You won't believe this. The light, they measure it in lux, L-U-X, okay? The light in your house is about 100 lux, okay? If you walk outside on a cloudy day, okay, it's 1,000. Wow, 1,000 lux. We need about 15, 30 minutes of that. If it's a bright sunny day, it frankly can go to 10,000 to 100,000 lux. And our brain is designed to absorb this light and affects the chemistry of our brain and lifts depression. Ever notice if you walk in nature, like I try to do even on a winter day, I just wear different clothes, okay? Weather doesn't matter to me, and I feel so much better. I mean, but I also look at the leaves, I look at the bark. I might even sing to the birds, yeah. Yesterday, a cardinal was to me, and I did it back to him. We're friends. He follows me. You think that makes me feel good? Yeah, it makes me feel good. Yeah. So relating to nature, sunlight exposure, what's your interpretation? I mean, some even bring lamp therapy, light therapy into the home. It's about an inch above their head and exposed. What, do you use that at all? Light therapy?
People that use it.
Do you?
Yeah.
Mm-hmm. And so if there's a moderately severe depression problem, you can't get over it, and your pills aren't working, or you don't want to take them, try light therapy. And this book describes it in more detail. And now maybe you can buy one for $200 or so and use it for X period of time.
Seasonal, often.
Yes, what's called seasonal affective disorder.
Absolutely.
Yeah. And I think we've noticed it even here, certain wintertime, you know, people get down a little bit and they start eating bad food or smoking cigarettes or drinking some alcohol or frying their brain on being the internet, sitting down 8 hours a day, which can lead to bad health, creating a different world in the internet. I saw this in some of my patients, especially kids. Social support is important, right?
Absolutely.
So I think belonging to an organization, I belong to the Round Table, for example, and belonging to a church is helpful to lift depression. Having a friend, having a pet. Having a pet can be a value. You know, here's a good one for you. One of the last patients I saw in neurosurgery was an 88-year-old female, was having trouble, pain down the arm. Nobody could solve the thing. His daughter's sitting there with a yellow pad taking notes, and medication wasn't working, rubbing it wasn't working. I solved the problem, though. You know what I did? I got to admit, because I read it in a book somewhere, I took a script and I wrote on there, "Get a little dog." It worked.
Yeah, I believe it.
They came back in a month, and there's the daughter holding the dog, and she looks me straight in the eye and she says, "Dr. Kachmann, it worked." And they get up and left.
That's great.
Isn't that a great story? So even my two cats at home, I have two male cats, Tonkinese cats, they're always sleeping in my chest. I'll wake up middle of the night, and they're both laying there over my heart. So I think they feel the electrical energy or neurotransmitters of my heart or something. It's always here, never on the right, always on the left. So it's my quick fix. I get up in the morning, hug the wife, my pets. I go downstairs. I have bird feeders, and I get rabbits down there, and I have birds in there. Occasionally some deer show up. I mean, the other day I think I communicated with a rabbit. I was winking my nose, and he's winking back. Dr. Doodle himself. And it makes me feel good. You see how to raise, depression. And and sleep is a very important thing. It's the social support, but sleep. And a lot of the depressed people you see don't sleep well.
Either sleep very little or oversleep tremendously, and that's,
they won't wake up.
Productive,
yeah,
right.
Yeah. So, and tricks on sleep are get the lights out, get the noise down, don't eat just before you go to bed. For example, don't drink a whole bunch of alcohol before you go to bed. All these things interfere with sleep.
Right.
And then keep the noise down, and try to go to bed the same time every day. Yeah. And try to get up the same time of day, because we have in us an eternal clock, which is regulated partly by depression, also by sunshine, and also about when you do it. Try to go to bed at the same time, get up the same time, and they affect, some people can't sleep, they become depressed. They feel down, and one I like to add to it, which he didn't include in his 6, nutrient-dense eating. I think eating the right food, no diet, eating the right food, vegetables 70-80% of the time, fulfills your nutrient need and affects your mood. It affects your mood. So an engaging activity, we talk about it, and don't ruminate all the time about some problem you have in IRS or your employer work. What good does it do? I read the work of Norman Vincent Peale. I don't know if any of you know him, but I had somebody walk in one day because I cured his wife or something, and the husband gave me all the books of Norman Vincent Peale. You can if you think you can. Visualization, power, positive thinking. And he was in New York. I even went to his church one time. And I remember he had one in there which I enforce every day. After 7 o'clock at night, I don't allow problems to be discussed in the house.
I like that.
7 to 7. They belong to the guy above, whatever you believe in.
And spirituality is so important.
And spirituality is so important. You find that important too?
Oh,
people
absolutely.
are more spiritual, have less depression.
Absolutely. And it doesn't have to be a specific doctrine, some kind of connection with something bigger than themselves.
Bigger than themselves.
Yes.
Yeah. Connect themselves to the universe, even if they don't have a specific doctrine, they can believe in nature, for example.
Absolutely.
Nature is their God, for example. I have some people tell me that. So I think some connectivity to something or a church or a belief, very important. People do better, and you're going to get social support there. I think this is important. And we spoke about sleep, but when people get into major depression, really big time, your energy is the biggest thing, isn't it?
It's huge.
They just don't want to get up.
Yeah.
And they have memory problems, sex problems, work problems, and some come so down they curl up and they consider suicide. So if you have a depressed teenager in the house or a spouse in the house or whatever, get rid of the guns in the house, okay? Yeah. Even you say, well, we lock them up, whatever. You don't know when someone's going to figure it out. They've actually found if there's a gun in a home, the most likely person to get killed from that gun is somebody in that family. 4 times as likely. Yeah, people don't think about that. So people, you know, we have 100 guns in the home. Well, the most likely person would be killed by a gun, family member. It's not an anti-gun statement. I'm not against owning a gun, but if there's a depressed person there, get rid of them, because suicide is on that list.
Absolutely.
We warned you. We warned you. I see, you know, a lot of that. The official psychiatric association, the DSM, lists about 10 symptoms of depression. So we want to review them again a minute. Depressed mood, okay. A large increase or decrease in appetite. We spoke about that. Overeating, undereating. And loss of pleasure of all activities. Nothing makes them feel good. Insomnia, hypersomnia, slowing of physical movement, or increased agitation, okay? Fatigue, excessive feeling of feeling down, difficulty concentrating, making decisions become difficult, frequent thoughts of death or suicide. If you have 5 of those, the DSM Psychiatric Association would say that you could diagnose a major depression. Yeah. Now, every one of these, a major depression, would you put them on medication?
No.
No?
No.
Okay.
I would
try other things.
If somebody gets into severe based on how many symptoms there are, and then I would say based on duration, you might suggest someone get a medication right away, maybe something more stimulating, so that they can, if they're not getting out of bed,
it's an
6 out of 7 days a week.
Individual judgment to the situation.
Yeah.
It takes an experienced person like yourself. I think this is just great. In my own experience, one of the biggest problems that I saw as a neurosurgeon is that the patients come in with depression, as Dr. Wilson said, mild, medium, severe. They're misdiagnosed. They're off to the operating room, and this book clearly states that depression, and I want your opinion, depression can cause pain in your body worse than cancer, worse than childbirth, worse than a broken back. Depression can cause severe pain, but you could see when they're using the MRI scan or CT scans and say, well, that's your problem, when in reality it's your neurotransmitters in your body that are causing the problem. Can you imagine that pain is worse? Can you imagine living like this day after day, day after day, week after week, month after month? You in such severe pain, you could almost understand why some people would do themselves in. Yeah, I think most physicians do not know that depression can cause such severe pain, worse than cancer or a broken back. Oh yeah, the last one they mentioned in this book, and I had it once. I fully understand it. Kidney stone. Oh my gosh! and I was eating too many nuts. I had a kidney stone, and that gave me a real education in pain, and the depression can be worse than that. Just no let up. It's day and night, every day, every week, every month. So depression is a serious problem, and it must be addressed, one way or another. And it's worse than anything they endured in the way of physical pain. They say it's worse by order of, I'm reading the exact words, order of magnitude than the prolonged natural disabilities, spinal surgery, kidney stones, sobbing in a fetal position. Depression can do that. And then they use the nocebo That's negative speak, okay? I like it. This you can read a matter of hours. To me, this book is critical. Nocebo, the evil twin. Placebo is, I give you a pill. If you believe it, 70% chance it'll work without anything in it. As long as it's a red pill or blue pill. In this country, you can't write prescription for that, but in Europe, you can. Yeah.
Really?
As long as you believe it, because it's real secretion of neurotransmitters, make you feel good. Yeah. But the other word, then, nocebo, hardly anybody's heard of that, which surprises me. They won't teach it in med school. You hadn't heard of it, had you?
No.
When we spoke about it. That's the negative speak. The MRI just shows a lot of things, but it's got nothing to do with you. That's your license to operate somebody. That's the nocebo. But they do it also with angiograms and heart surgery, for example. Oh, look at this very abnormal test. You're not having any trouble, though. You just have an abnormal test, and they want to do things to your heart. Happens a lot. Happens a lot. So second opinions, even in that, are important. But it's in other things. I see it in sinus surgery. Sinus infections don't cause headaches, but they'll tell you the headaches. Usually it's a migraine. And they use the x-rays as a nocebo to work on your sinuses. An interesting thing is, I saw somebody get operated, although I had advised against it anyway, and they felt better. Why did they feel better?
Placebo.
You got it. You got it. The placebo effect. You got it. Bang. I'm proud of you. I'm proud of you. The placebo effect. And I couldn't totally convince the husband to take it easy about his jubilation. But I had best done this, but I couldn't help myself. I know too much about this. Yeah, it was a placebo effect. That lady is still on narcotics. Yeah. Oh yeah. Yeah. He wouldn't. She probably had been on so many years she never got off. In 20 years, 20 years of taking narcs. You know, it's you can put them on Suboxone for long-term maintenance. It won't cause a high. It's still a narcotic.
Right.
It's
But it won't do for them.
Yeah.
That's only a partial agonist. It won't do for them what the other narcotics do.
You got it.
So they probably won't like it as much.
I see head of our public health here. She was saying that she wants every doctor in the county to be trained to use Suboxone, to be Suboxone trained, probably the guy she sent them to. But the darn trouble is, it's still a narcotic.
Right.
It's still a narcotic. It doesn't cause the high, and for some people, it may save their life. But we're going to put the 30,000 people that are addicted to narcotics in this county on Suboxone? Give me a break.
It's way better than methadone.
Way
better than methadone.
Thank you.
I believe in harm reduction.
Yeah.
I do.
Yeah.
And what's Suboxone?
And I believe in it too, but I don't want 30,000 people to be on Suboxone. You know.
Oh, and I don't think they have to be. No.
You know what I mean?
No.
But it has value. It'll save some lives.
Yeah.
But
I do.
But to go to work regularly flying an airplane, I don't think it's going to happen.
No. And I think some doctors that do Suboxone give much higher doses than people can be successful in any occupation on 4 milligrams to 8 milligrams, even if they've been addicted to heroin for 10 years. But some doctors will give them 16, up to 32
They're really
a day.
They're really creating an addict again. I mean, right?
Essentially, the behavior's not going away, and
it's a complex problem. But my opinion has always been that's important, but not to write a narcotic script in the first place.
Last resort.
Because 80% of the pain problems that I saw in my practice, you don't know why they hurt. And to me, it's just my opinion. I wrote books on it. They should not be given a narcotic.
No,
I even made up a name for them.
Like candy for so long.
Yeah. I even made a name for them. It's one of my 3 books that are on Amazon on pain. I called them the metabolic people. I just made it up. It could be the watch people. But that way, that 80%, you don't give narcs. And narcotics haven't been shown to work beyond a month or 2 anyway. They should be given something else. Should be these 6 things we spoke about. It's a complex subject. And it's definitely a complex subject. And also for depression, I saw at my hospital I was working at, it's not done as much today. They use electrotherapy, ECT. What's your thought on that, electroshock therapy?
Well, I know somebody personally who says it saved their life.
Yeah.
Personally, I get excited when I talk about it. Transcranial direct current stimulation stimulates alpha waves in the brain. I bought a thing for myself, and I use it, and I like it. Feels good. I know there's not a ton of evidence yet.
Yeah, they don't put you into seizures or anything.
Oh no,
no.
It's like a light massage to your
okay.
temples.
Now I could go.
It's relaxing.
I could go for that because it probably secretes some neurotransmitters, make you feel good.
If it weren't for liability, I would do it in my office and let other clients try it. You know.
Yeah. But an awesome guy. I remember a guy at, I think it was at St. Joe. They had it. He was all day long. He was giving ECT where people go into seizures, but there are complications too. Some have memory loss,
right?
And I see in this book it doesn't work more than a couple of months. You know what I mean? But some people in severe depression who can't take the medicine, it has value.
Right, but the benefits have to outweigh the negatives, and
is there? And I see drugs they use, Lexapro, Zoloft, Effexor, Prozac. These are all serotonin function, SSRI type medications.
Yeah.
They keep you from destroying the dopamine, serotonin that are between the axon and the dendrite, right?
Right.
They're not reabsorbed, so the level stays up, so you feel good longer.
Well, the stuff you're making gets where it needs to go.
Where it needs to go.
Yeah, that's.
And I also mentioned in this book that we're hardwired to a person-to-person relationship. The ancient tribes, they were always a community. That's why I've made about 10 house calls on Amish people just to learn their culture. And I speak German. I wanted to learn more about them. And things like Alzheimer's disease, depression, they never heard of it. Yeah, it's such a strong community. They don't feel good, you know what I mean? I notice most of their churches have 100 people in them. The number of families till they reach 100, that's a church. So there's commonality and a lot less stress. Plus they work hard too, you know.
Oh yeah.
You know what I mean? It was interesting. I learned a lot about their culture. And we have to get away from I would have, I could have, I should have, why a lot of people, you know.
We call that cognitive distortion or thinking errors.
Yeah, cognitive therapy. When you do cognitive therapy, what are the things you say to people? Do you want them to do?
Well, for one, we talk about common cognitive distortions, catastrophizing, the woulda, coulda, shouldas, things like that. So we talk about how to avoid them and building that into your
Don't
regular
discuss problems.
process.
7 and 7.
I love that. I'm going to use it.
Know that.
Oh, yeah. I'm going to steal it.
Norman Vincent Peale has in his books. I love that. That's been practiced in my house probably 10 years, ever since I read. I actually went and visited his church in New York. When they found out I had all his books, they wouldn't let me leave. There's the Marble Church, New York City. And you know who used to be? There's one famous person who actually was raised in that church? Donald Trump. And I didn't say I voted for him, but he was raised in the Marble Church. I read that. Isn't that interesting?
Well, I'll be.
Yeah. Interesting. And I read that. Yeah, it was about 2 years ago. Yeah, they wouldn't let me go. And actually, there's a picture of him outside, a statue of Norman Vincent Peale with his finger like that. And I jumped in the air with a real fancy sweater on and came with an inch of touching. They took my picture, and that's my face page on my computer. Because, I mean, you can if you think you can, power of positive thinking. Visualization, if you visualize something, it's more likely to happen. How about that? All his books. Yeah, I have them at home. I treasure them. They're signed by him. and his wife
Yeah.
Ruth. They're both dead now, but that was something. And people get depressed. It actually causes toxic changes in the brain. So, but it can repair itself over a few months. The lack of dopamine, the lack of serotonin causes enzymatic changes in the membrane. So, so about 150 million people in the U.S. Have had at least an episode of depression. Yeah. And many times, after a few months of recovering, then the brain returns to normal. The toxicity leaves. If you've been depression-free about 6 months or so. But about 70% of the people don't ever need medication. Okay, that's what he's saying there.
I could believe it.
Huge study done by the FDA. And but the FDA ran a very large study and found that medication is no better than a placebo in 56% of the depressed patients.
I could believe it.
You believe that too?
I could believe that.
Interesting.
Yeah.
See, I somebody I can bounce this stuff from, and so. And medications many times after a few months poop out. Just don't work.
Oh yeah. Yeah, and unfortunately sometimes people have to try many different ones.
medications.
And sometimes they need to do that because they really need it, but a lot of times they would be better
many
with
times I
other
read too that it takes
ways.
months for it to work.
Most of them takes 4 weeks to really feel benefit.
Okay, that's.
And if you have to titrate to a certain dose before then, it could be 6 to 8 weeks. Yeah.
What about this? About where you have to give some medication, and they also did the 6 or 7 lifestyle changes I already spoke about. Wouldn't that be a neat idea?
Absolutely.
Medication, the lifestyle change.
Absolutely.
You know, maybe both work, maybe one works. That would be
then
great.
You can wean off the medication
and then wean off
keep
medication
the lifestyle
and
changes.
Keep the lifestyle. Probably live to be 100.
Oh.
With a normal mind, normal body. Won't get diabetes because you're eating right. You know what I mean? Come on, let's shake hands on that. That's the way to treat it. That's the way to treat it. You know, cognitive therapy, lifestyle changes, and if you need medicine over time, get rid of it. And and they mentioned too in this cognitive revolution, probably there are 400 different systems of treating the patient. That's what you're saying. You know, for people. But I think we made it pretty simple here. You know what I mean? And this comes from Duke University, your own experience, cognitive therapy, lifestyle therapy, medication for the severe, thinking of stopping it in the future. Hey, we've had an approach to it, and very interesting. And there also Jacobson did a study and called it behavioral activation. Do you have ever hear of that?
Yes.
You tell us about that.
I'm familiar with it.
Yeah, tell us about that.
Well, it's retraining your behaviors.
Oh, okay.
I guess activating positive behaviors to replace negative ones is kind of a behavioral theory. I haven't studied
so it's really part
in-depth
it's really
behavioral
part of
activation,
lifestyle because we're re-educating our body.
Yeah.
It's really no different, is it?
No, not much.
He may have gotten his name on something, but it's just a tweak.
Yeah.
Yeah, it's a tweak.
Yeah.
And do you still see much of this ECT electrotherapy around?
No.
I mean, years ago I did see it. My gosh, I mean, I saw it a lot. And but that's kind of going down the tubes pretty much, where they induce seizures and you know, years ago I took my training at Georgetown, and I met a Dr. Freeman there, and he had done 50 years ago frontal lobotomies for depression.
Yeah.
Oh yeah, they used to take out part of the frontal lobe. That went out a number of years ago, but I personally met him. Yeah.
Did he
make
do
a little
with
hole and suck,
ice pick?
And they suck. Yeah. That's just about what it came down to, and that's what really came down to. I remember one of the neurosurgeons who worked there, looked the other way. He couldn't stand when the doctor would come in and do his little cut of the Cingular gyrus, I think it was. Yeah, he couldn't stand to watch it. But that was, you know, when you have people living down there severely depressed and they didn't have those medications, then you could see the point. You know what I mean?
Yeah.
I mean, a significant number probably were suicidal. And
ECTs at least has some evidence base. I don't know the lobotomy for depression.
Yeah, I don't think they did a controlled study.
I don't think so.
But it was done.
Not placebo controlled.
Years ago, it was done. So again, reviewing the 6 factors, let's concentrate a little bit on the omega-3 a little bit. The good essential fatty acid. You hear about DHA. That's a long fatty acid, a long chain fatty acid. DHA, you'll hear those terms. And how much supplement should you take? I personally think you ought to speak to the pharmacist or your doctor or therapist like yourself. I mean, in what this doctor recommends is a dosage of about 1,000 of EPA and DHA. Those are the chain essential fatty acids that control, remember, the conductibility of the membranes of your body, where dopamine and serotonin work to improve the ability to manifest themselves. You need the omega-3 and the omega-6s. For example, if you're eating a lot of meat products that have been fed corn instead of grass, for example, remember omega-3 is in plants. Plants pick up the energy of the sun, which makes the sugars in the leaves and the fats too, and fats. That reminds me of my sugar maple standing next to my kitchen. The leaves are starting to open up, and I understand per day they make hundreds of pounds of sugar. These beautiful pink leaves. It isn't just a little bit; it's a lot. But that's the energy of the universe. But in there, omega-3s. Yeah. So if the animal that you're eating is not eating plants, for example, you're bringing to you instead the bad fats, the omega-6s, to your body instead of the good omega-3s, which are in plants.
I know.
So when you order fish, you ought to ask, is it from the ocean or from a pond? I tell you, most of the time, I even go to a country club here, and they'll say Scottish salmon. It ain't from Scotland. I checked it.
Yeah.
It ain't from Scotland. It's from a fish pond. So, if you eat the animal or fish or beef, say, what they ate before, that's actually what you're eating. So if they eat bad food, you're eating bad food. Yeah. What food did they eat because that changed the chemistry of their body? Isn't that interesting?
Makes sense.
Isn't that interesting?
Yeah.
And there's some omega-3s in nuts, for example. Seeds has more omega-6s, but we need some omega-6 to run the internet of our body, okay? The essential fatty acids. Essential means you got to eat them, okay? So it's okay. The activity of living. I'd like to talk to you about that a little bit. And you say, you know, I actually found out, you see, what % of the people exercise regularly? What do you think?
20%.
See, now, that's a good answer. There's one thing wrong with it. It's wrong. Yeah, that's what I would have guessed. They follow them, 3.5%.
Oh.
Yeah, and like at Planet Fitness here, a great place. I work out there because people ask me to teach them things. I really like that place. I'm only mad that I did myself bring it to town, and because the things that I believe in. Yeah, they say 10% of the members come there monthly. Only 10%. Yeah, I mean it's real cheap, so it was a lot of money. They say I work out, but they don't work out. Yeah, 10%. But then they were selected to be there in the first place. So you see the 3.5. That's based on many studies, instinct. So I encourage people, of course, to work out. That's fine. is to increase the activity of living, walking the dog. If you stand up, that triples your calorie burn. Yeah, based on gravitational studies. Yeah, when you everything in your life, in your body, is based on gravity. This is based on NASA scientific studies. I've reviewed those studies. That's why you want to hear sitting disease, people sit down. There's no gravity. Yeah. If you sit for 2 hours, you might as well smoke a pack of cigarettes. That's been scientifically proven.
Why did I quit smoking? I sit all day. I'm kidding.
And, yeah. It turns an enzyme, LPL enzyme, on and off in our bodies. That's in all our vasculature. Increase your activity of living. Okay, and we'll you summarize here quickly. If this is, say, your calorie burn for the day, let's say this size, okay, 30-40% is basic metabolic rate, 20% the kind of food you eat, and the rest is activity of living. So walking the dog, dancing, for example, working out, keeping some weights under your desk. You hear about treadmill desks today. And the reason for that is we're trying to increase our exposure to gravity. So on Amazon, I have a book called Sitting Disease. It's worth reading. It's the science of it. In summary, learn about these 6 or 7 things that you can do to improve your lifestyle to avoid depression, because that's about 70-80% of depression. 20% maybe severe, maybe you need some medication. Maybe you need a great therapist like Grant here. And thanks for being my guest.
No problem.
Think you gave us new information, and you backed up some of my information. And you can watch my other shows on YouTube. I got 300 or 400 shows on there. If you need to see somebody in person, you can see Grant or myself at the Three Rivers Pharmacy. I'm not a psychotherapist, but I teach wellness. I can help get rid of a lot of your diabetes, mild depression, teach you lifestyle, for example. But we need licensed, efficient people, and check with your doctor. Don't stop your medication because of this lecture. You need to speak to your doctor or your therapist. I'm just trying to educate you about what is depression, and that most of us have at one time or another, and that it can cause illnesses. I don't want you to have some surgeries done that could be avoided by understanding this better. Know about nocebo placebo. Go on Amazon, read this book. It'll take you about 2 hours. It may save you a lot of trouble. Thanks for watching the show. We did this because we love you. And Greg, we're going to have you on this show again. Bring some of your partners. We're trying to educate the community.
Thanks for having me, Dr. Kachmann.
My pleasure. Just to think we barely met the other day over a cup of coffee. And you saw me reading a book. You said, "Hi, Dr. Kachmann." What a wonderful world.
The views and opinions expressed do not necessarily represent those of Access 4.